You can keep. Okay, I'm just gonna skip to medicine. Just in your free time, abortion like a million. Are you there? Oh, okay.
You're
I think my
you're
computer
cutting in and
just,
out,
or my
Ellie.
iPad's just slow. Okay, so, oh no, that's not good. Can you hear me now?
Yeah, we can.
Can you guys hear me? Okay, so I wanted to start off today by showing this timeline of reproductive oppression in the United States. So I want to give you guys like a minute or two and share with me thoughts. So what are your thoughts on this timeline? What did you gather from it? Does anything on there surprise you or just stand out to you?
There's just so much on there.
Yeah, it's a lot. I think the biggest thing for me, and for the other stuff in the doula program that when we share this, is that the majority of these oppressive policies have been enacted fairly recently, which I think is surprising. Between the past 100 years or there that we've been trying to do to oppress people and to prevent them from having their freedom. And a lot of it, almost all of it, is targeted specifically at Black and Brown people and at poor people. And so the goal really is control, whether it's preventing access to abortion or preventing people from controlling when they conceive and carry a pregnancy, or when they're able to, not worry about your son being shot by the police and being pulled over in the car. Like all of those things are reproductive justice issues that are continuing to happen in the present day, and we see so much mirrored in the past, that we see now, like forced sterilizations, people that are getting away with sexual assault and misconduct, like all of it has been repeatedly frustrating. Jonathan, you don't have to share any more slides. I'm just gonna like freeball it if that's okay, just because I've been talking so much in the past ones. But something else I wanted to talk about is the Hyde Amendment. It is a provision, so not a law, but actually a provision that prevents government spending on abortion services. Prevent people from and that's just terrible. That are really that affect inconvenience for there are provide abortion to the things that the surgery centers need to have. And all of it is just to make it more difficult to provide care and to maintain ability to keep your staff. And what it looks like for my patients when they come in for the consultation is ending up to being at the surgery center for 3 to 5 hours without ever receiving care. The only thing they get that's remotely close to healthcare is when they leave a urine sample and get a blood draw. But other than that, like my ultrasound is almost entirely unnecessary. Like the heartbeat has nothing to do with their abortion care. Like I cannot stress enough that it literally does not have any effect on people's healthcare. I think if it's something that someone wants to know, that's fine. But other than that, like you really don't need it. Dating is important, but other than that, it's like there's no point. And then I spend half my day writing these fetal heartbeat determination forms that the patient has to sign, and it starts one of their 24-hour waiting periods. And that is just a big pain in my ass. It's a big pain in my patient's ass. It has this statement on it that is very charged. It says like, I understand that I am terminating this unborn human individual. And it's just very frustrating. Yeah, Anish, you can go ahead and hop off mute.
Yeah, it's all awesome, everything you're saying. So I'm taking medical ethics right now. One of the things they were saying was that they kind of have to assess the how should I say this, the autonomy of a minor who's like electing to have an abortion. And when I was reading that, I'm kind of frustrated because it's almost as if like that person has to go through a bunch of like processes before even having the option of having an abortion. And I thought it was interesting that like a governing body of medicine is kind of advocating for that. So have you seen any like advocacy against those kinds of rules, I guess?
Yeah. We have a lot of minor patients who come in, and if parents don't consent to having them having an abortion, or they don't sign the form, come with them, they literally have to like show up. Then they need to get a judicial bypass. There is a lot of, I think, particularly with groups like NARAL and Planned Parenthood Advocates of Ohio, and Planned Parenthood Action Fund, that do that kind of advocacy work. I don't do that work just because I spend my time mostly with patient care. And I am fortunate that my patients aren't allowed to have guests in the ultrasound room with them. And we intentionally create spaces where we are alone with the patient, both during their education when they go through their paperwork and get all these laws explained to them, and during the ultrasound, so that can to assess that patient, because one might come in for an abortion, one wants to carry and continue a pregnancy, they have that right. And if someone wants to have an abortion and like their parents won't let them and stuff, like if someone's old enough to get pregnant, then they should take care of a child. In my opinion, they should be able to choose not to carry a child if that's what they want. And there are definitely people with different beliefs on that. It is so up to the individual that you really can't force that on people. And I think that's a really good point, Anish. I think like you don't need a law, like you don't need the government to tell you how to do all of that. Like there's a reason we have social workers, and like why physicians and nurses are trained the way they are is to be able to discern that. Like if you're a healthcare provider and you can't figure out if your patient is consented for whatever you're doing, abortion included, then you're not trained right. Like that's not okay. And so I think we can achieve that without a law, in my opinion. The other thing I wanted to talk about with our spare time, I don't know how much time we have left, is about abortion procedures in general, because not many people have really know about how abortion works and the way that all of our laws are set up. It feels like abortion is very dangerous and difficult and that it's separate from other kinds of healthcare, but it's really not. It's very similar, actually almost identical to the same kind of treatment someone who's having a miscarriage might have. It's the procedure is literally the same, the medication is the same. So the medicine, the first pill stops the pregnancy from growing, and then the second pill induces your body to get rid of all that pregnancy tissue. So patients experience a lot of bleeding, cramping, they pass a lot of clots. And then for the procedure, essentially the doctor does the work for that patient's body to get rid of all the contents of their uterus. So they'll they'll numb the cervix, and if to dilate it, they will. There's a medicine that people can take to help dilate the cervix and soften it. And then they'll go through it. And the cervix is the opening of the uterus. I'm sorry I didn't clarify that earlier, but it's the canal where everything goes through before it gets to the vaginal canal. And it's a very important piece of the body. But once they go through the cervix and enter the uterus, they'll use a suction to get rid of all of the contents. The suction can either be manual. If you've ever pulled on a syringe and seen that fluid come back, it's the same process. They also have crazy vacuum sounds or fetal parts flying around, none of that. It's very controlled. It only takes 5 to 7 minutes. For pregnancies that are later, around 18 weeks, it's a 2-day procedure where instead of just taking a medication to soften and dilate the cervix, the doctors will actually insert what are called laminaria, and they're derived from seaweed, which I think is super cool, because it just shows that we've been doing abortion since we've been able to get pregnant. But yeah, they put this product in and it dilates the cervix, and then the next day they have the doctor remove the contents of their uterus in the same way. It takes 15 to 20 minutes. Most patients say that what they experience a lot of cramping. This is very safe and very simple, very fast. A lot of people are surprised how quick it is. Do you guys have any questions about abortion procedures or about Planned Parenthood?
I guess I can ask. I don't really know the cost, I guess, of an abortion procedure. So if you could just shed some insight onto that, that'd be great.
Yeah, that's a great question. In Ohio, at least at our surgery center, it costs $700 to have an abortion, whether it's medication or the in-clinic procedure. If the pregnancy is a little bit later on, the cost is going to increase. There are a few things that patients also have to pay for as well. If they want to get sedation, then they might pay a little bit more to have the moderate or minimum sedation. And then if the patient has a C-section, then that complicates the procedure a little bit. And so they might have to pay a little bit more, which we've been trying to get rid of some of those things because someone can't really control their medical history. So we do our best. There are funds that help people pay for their abortions. One of them is called Women Have Options. Like good place to help someone get their care. Talk your ears off, and I talk very quickly. Please don't hesitate to ask questions or check out the slides that Maria sent out.